Hey, Dr. Lucas Marchand, the house call chiropractor here in Sioux Falls, and I just want to do a quick video on what's going on when you get adjusted. So stay tuned. So chiropractors treat many different ailments, from knee issues, shoulder issues, elbow, extremities, plantar fasciitis, all those kind of things. But our bread and butter, or maybe what the public thinks of us, is neck and back pain and headaches. Your spine is dynamic, meaning it's supposed to rotate, it's supposed to laterally flex, bend forwards and backwards, etc. When it gets stuck, even if it's in a completely neutral position, that area that's stuck the muscles around that area tend to spasm up and you feel pain. And what we're doing as chiropractors is we're searching for these areas of aberrant joint motion, or joints that are stuck, and we're delivering what's called a high velocity, low amplitude thrust to that segment, aka an adjustment. Now, when this is done by hand, you might get some popping, right? That popping isn't a bone on a bone or anything like that. What's going on there is there's a gas in between the joints, and when we adjust that segment that's stuck, it goes from a liquid state to a gas state, creating a pop. It's kind of like when you open a can of soda, you hear that popping sound. It's sort of the same thing. And as chiropractors, a lot of times we're looking for that feedback, because to me at least, it tells me that the segment that was stuck, that I'm trying to get unstuck, just moved, and that's a good thing. And typically what happens after that is, after an hour, a couple hours later, people start to feel better. The muscles around that area tend to loosen up and the joints are moving properly again. Now, sometimes it takes a couple sessions, sometimes it's just one visit, but everyone's a little bit different. But usually after an adjustment, depending on how severe it is, people feel pretty good. And that's exactly what's going on when you get adjusted.